What's going on, guys? It's Humphrey. Today we'll be talking about bladder cancer. Bladder cancer is a common type of cancer that begins in the cells of the bladder. The bladder is a hollow muscular organ in your lower abdomen that stores urine. Bladder cancer most often begins in the cells that line the inner parts of your bladder. Those cells are also found in your kidneys and the tubes that connect the kidneys to the bladder. Urothelial cancer, I know I'm saying that wrong, can happen in the kidneys and in the ureters too, but it's much more common in the bladder. Most bladder cancers are diagnosed at an early stage when the cancer is highly treatable, but even early stage bladder cancer can come back after successful treatments. For this reason, people with bladder cancer typically need follow-up tests for years after treatment to look for bladder cancer that reoccurs. Some symptoms, what you may either see in a person or you might feel yourself. Blood in your urine, which may cause urine to appear bright red or cola colored, though sometimes the urine appears normal and blood is detected on a lab test. Frequent urination, painful urination, and back pain. When to see a doctor if you see yourself having some of those symptoms, or you may feel like something is not right in there, just ask your doctor, talk to your doctor, and they can make an appointment, or you can just talk to them. Hopefully you guys can figure out what it actually is. What causes this? Bladder cancer begins when the cells in the bladder develop changes in their DNA. A cell's DNA contains instructions that tell them what to do. The changes tell the cells to multiply rapidly and to go on living when healthy cells would die. The abnormal cells form a tumor that can invade and destroy normal body tissue. In time, the abnormal cells can break away and spread through the body. Types of bladder cancer. Different types of cells in your bladder can become cancerous. The type of bladder cells where cancer begins determine the type of bladder cancer. Doctors use this information to determine which treatment may work best for you. Types of bladder cancer include, I'm not even going to try to say these, so I'm going to put them up on the screen. I'm just going to abbreviate them. This one is UC, previously called transitional cell carcinoma, occurs in the cell that lines the inside of the bladder. These cells expand when your bladder is full and contract when your bladder is empty. These same cells line the inside of your and cancers can form in those places as well. This type is the most common type of bladder cancer in the United States. The next one, squamous cell carcinoma, is associated with chronic irritation of the bladder, for instance from an infection or from long-term use of a urinary catheter. This type is rare in the United States. It's most common in parts of the world where a certain parasitic infection is common cause of bladder infections. The last one, this begins in the cells that make up mucus secreting glands in the bladder, and this one is also very rare. And some bladder cancers include more than one type of cell. Some risk factors: smoking, increased age. Most people diagnosed with bladder cancer are older than 50 years old. Being male, it's kind of fucked up, but men are more likely to develop bladder cancer than women are. Exposure to certain chemicals. Your kidneys play a key role in filtering harmful chemicals from your bloodstream and moving them into your bladder. Because of this, it's thought that being around certain chemicals may increase the risk of bladder cancer. Chemicals linked to bladder cancer risk include arsenic and chemicals used in the manufacture of dyes, rubber, leather, textiles, and painting products. So if you guys are dealing with those, just be careful. I know it's your job, but just be safe about it. Like, wear all the protection stuff you need so you don't have to deal with that. Hopefully. Fingers crossed. Previous cancer treatments, chronic bladder inflammations, personal or family history of cancer, some preventions. Don't smoke. Take caution around chemicals. Like I said, just be aware and be safe around them. Like, have the right equipment, like gloves or whatever you need for them. Choose a variety of fruits and vegetables. Choose a diet rich in the various of colorful fruits and vegetables. The antioxidants in fruits and vegetables may help reduce your risk of cancer. Alright guys, I hope you guys enjoyed that one. I know I butchered most of the words, but I'll put them on the screen. I love you guys. I know I'm not the best at saying all these words, but I hope you guys enjoy these videos. I hope they help you in any way, shape, or form. If they do, make sure you give it a thumbs up. Hit that subscribe button, turn post notifications so you don't miss out. And if you want to see like anything in specific, let me know down below. I do read all the comments. I love you guys. Stay safe. I will see you in the next video.